Every year, nearly half of all biologics, vaccines, monoclonal antibodies, and gene therapies fail before reaching patients. The reason? A complete dependence on the pharmaceutical cold chain. The cold chain involves strict temperature-controlled transport of medication from production to administration. These medicines must remain at 2 degrees Celsius or below at all times. This fragile cold chain means a single temperature failure can destroy an entire shipment of medicine. The cost of this is that $35 billion is lost annually due to cold chain failures. Also, low-income areas that do not have access to cold chain infrastructure are left without access to life-saving treatments. This leads to unequal access to pharmaceuticals and further exacerbates the pressing issue of pharmaceutical poverty. Not to mention that each refrigerated transport truck emits 8 tons of CO2 per year, the equivalent of 4 passenger cars. Clearly, the system is broken. But what if we could eliminate the cold chain entirely? Hi, my name is Subhiksha Stephan from Millburn High School, New Jersey, and I'm excited to introduce TardiBio, a breakthrough technology that keeps biologic medicine stable at room temperature, eliminating the need for refrigeration. TardiBio is inspired by nature's most resilient survivor, the tardigrade. It has the ability to survive extreme temperatures and pressures. At TardiBio, we have bioengineered the exact process that tardigrades use to protect themselves to stabilize cold chain medications at room temperature. Using a specialized class of tardigrade proteins and other proprietary excipients, our formulation forms a protective shield around drugs. Once the TardiBio solution is combined with the drug, the solution undergoes a customized spray drying process in which the medication is converted to a dry powder. This means that it can be easily packaged and transported to its desired location in non-refrigerated transport. Right now, biologic storage is stuck in a red ocean. Since the 1970s, the pharmaceutical industry has relied on outdated, fragile, and expensive cold chain systems to distribute biologics. The market size for biologic medications is growing rapidly. Due to the occurrence of more and more diseases worldwide, many temperature-sensitive medications will need to be distributed across the globe. Right now, our immediate soon-to-be customers are large pharmaceutical companies that use the cold chain now but wish to save time and money. They also struggle to expand into low-income regions because cold chain infrastructure is not feasible in the last-mile delivery to such areas. And although there aren't any companies that actively refuse to reduce temperature-sensitive medications, it happens that many low-income areas simply do not have the capacity to do so adequately. For instance, Africa's population is equivalent to 16.2% of the world population, but only produces 0.1% of the global supply of vaccines. TardiBio will have 2 main business models. For producers of biologics and pharma companies and biotech firms, it will have a licensing model where companies pay upfront fee of $5 million, which is low cost compared to typical licensing fees in the biotech field. Additionally, there will be a 3% royalty for every dose of biologics medications for TardiBio. Another business model involves partnering with specific biotech firms and pharmaceutical companies and selling bulk contracts of field-stable biologics to global health organizations, military and disaster relief operations, and independent clinics who purchase biologics. Now, since TardiBio eliminates the need for temperature-controlled facilities, biologics can now be stored at room temperature, completely eliminating the need for cold chain logistics. It also achieves this at a much lower cost compared to cold chain infrastructure. TardiBio raises global accessibility to biologics without refrigeration, which also increases the shelf life of medications. TardiBio's low-energy, spray-dried stabilization dramatically reduces waste and carbon impact. And for patients, TardiBio creates a universal stabilization platform for all biologics, as well as simplified supply chains and streamlined distributions. This innovation invalidates competition by offering a product that has a high shelf life, is scalable, low-cost, and eco-friendly. TardiBio is backed by hours of research on my part to ensure that it is technically feasible now. I've conducted many molecular dynamic simulations to analyze how the TDPs interact with biologic molecules at the atomic level. These studies confirm that the proteins effectively form protective matrices, stabilizing biologics in dry form without denaturing them. To protect this innovation, I have consulted a patent attorney and am in the process of filing a patent for a novel spray-dried biologic stabilization system. I'm also discussing with the Princeton Bioengineering Department to do further in vitro experiments of the spray drying process and its effect on the solution combined with biologics. I have identified funding sources and opportunity grants to support TardiBio's commercialization. By partnering with biotech firms, this can be scaled rapidly and adopted as the new industry standard. By eliminating the cold chain, we can save lives, reduce waste, and make medicine accessible to everyone, everywhere.